This is X-ray room. I'm gonna turn on the light first. And this is a chair. He's gonna sit down. And let him sit down here. I'm not sure I cannot bend it. Okay. The problem is that my patients cannot bend it. Oh. Okay. We can stop here, Dr. Kim. Okay, this is time for X-ray. If the patient coming back as a regular visit, you're going to assess caries risk assessment. Based on the risk assessment, we're gonna take a regular every 6 months recall X-ray, or we're gonna take either 18 months X-ray too. So it depends on the situation. We're gonna take a more likely 2 bi-wing or 4 bi-wing, or sometimes a PA based on the symptom and their situation. So let me show our X-ray room here. Let's say patients are sitting in this chair. I want you to set the height for patient. There's a pedal under there. You're gonna make the height. With the small babies here, you're making sure you watch out not to fall. And there's a lead apron. There's a small size for the little one. There's a big size for the teenager. So you're going to choose which size is best for them. Once you're done, apron ready, patients ready that, and here's a strap. You're gonna making sure they're secured that. Okay, without patient, I'm gonna show this way, and this is the X-ray machine. We're gonna move around it. Here's a section for, of course, please use a clean gloves for touching this. This is an XCP cone. You can use it if you're familiar with that. This is a snap array for PA or bi-wing. So these materials you can allow to use it, but please making sure you use a clean hand. This is all the cleaning supplies right here. So once patient's ready, I want anyone, you're gonna ask somebody watch over baby here, and come this way. Usually we prepare the material first and bring patient. So this is the developing room. You don't need to log in and out. There's an X-ray film, first drawer. There's 3 different sizes available, actually 4 different sizes. Can you see the 0 and 2 and 4? 0 is like under age 8 years old, either primary dentition or early mixed dentition. You can use a very small size 0. And for the bi-wing or PA, and this is a size 2, little bigger size film for the more than age 10. You can use it. If a patient has a deeper mouth floor, you can use it. But most of the case, mixed dentition, this is somewhat little bigger. So I want you to use a size 1 or 2, 1 or 0. Okay, here's a 1. When you take a look at 1 is a little bit longer medial-distal length. So which means you can take one picture, shows a distal of a canine to the very distal tooth. So you can see the more image using this size 1. So please take this benefit. Size 4. Size 4 we're gonna use for the occlusal X-ray. You can see the whole maxillary dentition or mandibular dentition at the same time. We don't take this usually. However, if you are looking at specific pathology such as medial dents or any other tooth anomaly or the mallocation, you may take that. So this is a size 4. And when you put it inside the mouth, you better use it vertically, but sometimes horizontally. But vertical is a preferred direction to go inside the mouth. So these are all set. So you need to use a clean hand. These are basic setting. Once you do that, there's an extra Skin X cover. We do have a carrier, but I cannot see here. However, once you're done, let me bring size 0 film to patient. We have a carrier box before. Once patients here, we're ready for that. Use your gloves. Make sure patient position is okay. Somebody watch the patient. And then bring your gadget. I'm gonna use a snap array, more likely. Or we do have a tape on it. Oh, there you are. It's a hidden transfer box. So we have a transfer box. So you can bring patients new one right here, going in and out. Okay. All right. So this is the tape. When you use a bi-wing, use it. You're gonna fold the middle. There's a wing, sticky wing, and then as you see that this is the opposite side of a toward the tube, so you're gonna actually bite on here. Am I correct? You're gonna hold it, attach. This is for bi-wing. Usually one side has an extra flange, so this one go to the medial. If you put a distal side of a mouse, they actually bother their throat. So I prefer not to use this side. This one should be a medial side. So when they bite it, we're gonna take a picture, go this way. So this is one thing, you can do it. And the other is a snap array. So once you do that, just want to get ready. Either you can do as a small baby one as a bi-wing, or when you do this, it's going to be used as a PA. So it's up to you. Put a location as you wish. If a baby has a slow, shallow mouth on the floor, you better use adjusted height, because this side is always bother their floor and they're gonna gag anyway. So making sure that you got the right position height here. Then snap array can be used for it. And once you're done, this is the one once you done use it right here. So patient's mouth touching area, not touching any surface of this area. So while taking patients and put it on inside position, XCP or snap array or tap, anything's fine. Making sure apron ready. So you're gonna picture it. Somebody push the button for me. You can ask it all the time here. Then set, go. Okay, great job. And somebody should watch your baby. Then bring this one with your hands, making sure I go, or you can use a transfer box if you want to. So go to the developing room. What I normally do, this is your paper. This is a patient mouth came. So I want to open it up and carefully position. This goes, your cover it up and draw the way and find your patient. Then set ready and use your ScanX scan. Then all images will be show up here. Okay, that's good. And once you're done, this will go through ScanX. It's like this, fold, and making sure you put it in an eraser right away once you have an image ready. Please do that automatically. And your used paper should be discarded right away. When it's ready, the light is off. Then talk to your attending about your imaging when we can discuss about the patient problem or dental caries or any perio issue or any other specific thing. So making sure you come to us and bring it and show your competence. Good. There's one more thing. Don't forget, this will be the clean hand. You put it in the right side here, and your used one should be cleaned out, sprayed it, throw it away, discarded. We have a box trash can, and there's a clean thing. either your spray right away here, making your spray, the cone, machine, and apron, chair, handle, spray all, and wait. This should be XCP or snap ray, whatever you used it, go to the back side. So I want you to follow me. And your used material should be in the sink area. Right here. Of course, you have a gloved hands, so you can do that. Put it in a system right away, or leave it there. Then we'll take care of that. Okay. Thank you. Okay, this is time for competency. When you are D3, if you are D3, here's a cabinet. Competency form is available. Right here, I already take it out for you, competency form. There's a 4 section, preventive services and growth and development, and sealant competency and radiograph competency. So more likely, whenever you have a competency ready, it's not your first patient. You must competent yourself and brag yourself how much you are competent. Then, whenever you're ready, take this paper, bring it to your attending that you're going to challenge a patient today. So once you have done everything completed, there's a section and rubric. Go ahead and read it. And which section you must competent yourself and get score grade ready from your attending. Every day has a little bit of different attending. Dr. Cheon, me covering Monday and Thursday. Dr. Shannon's gonna cover Tuesday, Wednesday. Dr. Ping Zhang cover Thursday afternoon. And Dr. Young, another adjunct faculty, cover Friday. So you need to bring this form to them and get theirs graded. And this is the most important thing. Once you're done, take a picture and you can put it in, upload it in your Canvas. That way, we centralized it without losing your document. I can grade it right away. So please making sure you complete this. Take a photo as your record and upload it. And based on the criteria, you must submit within 24 hours. That way, I can give you grade right away. When you delayed your uploading, it's gonna be deducted your score, which I do not want. Please making sure you read carefully all the rubric and the criteria and get ready, challenge yourself, grade it, take a photo, upload to Canvas within 24 hours. Let's do it. Thank you.